My name is Masayuki Kitano, Wakayama Medical University, Japan. Thank you so much for inviting us for this interview. We would like to talk about our original article. On behalf of all co-authors, it is my great pleasure to introduce our paper entitled Adverse Events of Self-Expandable Metal Stent Placement for Malignant Distal Biliary Obstruction, a large multicenter study. This multicenter trial included 26 Japanese tertiary care centers. Dr. Takashi Tamura, my colleague, talked about background, aim, method, and result of the present study. Dr. Tamura, please talk about background and aim of the present study.
Thank you, Masayuki Kitano. Hi everyone, my name is Takashi Tamura. The aim of our study was to perform a large multicenter cohort study investigating early adverse events and recurrent biliary obstruction in patients who undergo endoscopic insertion of self-expandable metal stent for malignant biliary obstruction. Endoscopic placement of stents is frequently performed to treat malignant distal biliary obstruction, which is condition mainly caused by pancreatic or bile duct cancer. Several structurally different types of stents have been described, including covered stents and uncovered stents, as well as braided type stents and laser cut type stents. The most frequently adverse events after stent placement are acute pancreatitis and cholecystitis. Some previous studies reported risk factor for acute pancreatitis and acute cholecystitis after stent placement. However, there was no large multicenter cohort studies have investigated that include the incidence of adverse event and risk factor for acute pancreatitis and acute cholecystitis after stent placement. In addition, recurrent biliary obstruction is one of the most important adverse events in patients who are undergoing biliary drainage with long-term stent placement for malignant biliary obstruction. Recurrent biliary obstruction is caused by food impunction and/or sludge formation, stent migration, tumor overgrowth, and tumor ingrowth. The most frequent causes of recurrent biliary obstruction depend on the type of the stents. Patients with uncovered stent placement often develop recurrent biliary obstruction due to tumor ingrowth, whereas patients with covered stents placement often develop recurrent biliary obstruction due to stent migration and food impunction and/or sludge formation. To date, few studies have investigated the risk factor of recurrent biliary obstruction. Therefore, the present study investigated early adverse event and recurrent biliary obstruction in patients who undergo endoscopic insertion of self-expandable metal stent for malignant biliary obstruction. In addition, the present study analyzed the risk factor associated with acute pancreatitis, acute cholecystitis, recurrent biliary obstruction, food impunction and/or sludge formation, stent migration, and tumor overgrowth and tumor ingrowth in these patients.
Okay. Please talk about the result of the present study.
Ours included the total 1,425 patients who underwent stent placement. This table shows the incidence and severity of all early adverse events in patients undergoing endoscopic stent placement. Early adverse events occurred in 16% patients. Acute pancreatitis occurred in 7.4% of patients, and acute cholecystitis occurred in 4.1% of patients. This table shows the univariate and multivariate analysis of risk factor for acute pancreatitis. Multivariate logistics regression analysis showed that independent risk factor of acute pancreatitis were pancreatic duct without tumor involvement, intact papilla, and stem placement across the papilla. This table shows the univariate and multivariate analysis of risk factor for acute cholecystitis. Multivariate logistic regression analysis showed that independent risk factor for cholecystitis was only tumor involvement to the OCD. This table shows incidence and causes of recurrent biliary obstruction. Regarding recurrent biliary obstruction, 27.6% patient occurred recurrent biliary obstruction throughout the entire study period. The incidence of recurrent biliary obstruction increased over time, occurring in 18.5% of patients within the first 3 months, 40.2% of patients within 6 months, and 73.6% of patients within 12 months. Recurrent biliary obstruction caused by food impaction and stretch formation in 10% patients, stent migration in 7.6% of patients, tumor overgrowth in 3.1% of patients, and tumor ingrowth in 2.6% of patients throughout the entire study period. In identifying risk factor for food impaction and stretch formation, multivariate Cox regression analysis revealed that both fully covered cells and partially covered cells were independent risk factor for food impaction and stretch formation. In identifying risk factor for stent migration, multivariate Cox regression analysis revealed that low BMI and fully covered cells placement were independent risk factor for recurrent biliary obstruction caused by stent migration, whereas partially covered cells were not. In identifying risk factor for tumor ingrowth, multivariate Cox regression analysis revealed that uncovered cells and laser-cut cells were independent risk factor for recurrent biliary obstruction caused by tumor ingrowth. In conclusion, the present study confirmed that pancreatic duct without tumor involvement, intact papilla, and stem placement across the papilla were independent risk factors for acute pancreatitis, whereas the types and structure of SEMS and endoscopic sphincterotomy were not. Tumor involvement of OCD was an independent risk factor for cholecystitis, whereas the types and structure of SEMS were not. No independent risk factor for recurrent biliary obstruction were identified, although several different independent risk factors were observed for recurrent biliary obstruction caused by food impaction and or stretch formation, stent migration, and tumor ingrowth.
We hope that the result of this large multicenter study bring useful information of how to prevent the adverse events caused by stem deployment. Thank you very much for your attention.